Well, many thanks, and many thanks for giving me the opportunity to speak to you today. We're really at an unprecedented state in human history. So for 11,500 years or so, humanity has been able to flourish in the Holocene period, which has been a relatively climatically benign period of human existence. But we're now moving into a totally different era, which many people are calling the Anthropocene epoch. And that's really due to the activities of one species, our own species. And what we're seeing is dramatic changes in the environment, in the global environment, which threaten to undermine many of the advances in health and development that we've seen over recent decades. So, for example, we've seen an increase in life expectancy, even since the turn of the century, of about 5 years on a global scale. But many of these populations are vulnerable to some of the disruption that could occur through these dramatic environmental changes. And one of them is illustrated in this slide, which just shows you the concentration of carbon dioxide in the atmosphere over the last 650,000 years or so. And what you can see is that it's been a dramatic change since the middle of the last century, so that we're now about, it's continued to increase, so we're now above 400 parts per million of CO2. And of course, other greenhouse gases such as methane, other short-lived climate pollutants have also gone up. So this is now driving us into an unprecedented changes in climate, and it's being accompanied, of course, by many other changes such as biodiversity loss, increasing acidification of the oceans, and many other environmental changes. So what does that mean for the future? Well, this slide just shows you, the pink red line just shows you going up the likely change in climate if we had unrestrained greenhouse gas emissions. It's a high emission pathway used by the Intergovernmental Panel on Climate Change. And you can see that by the end of the century, we could easily be at 4 degrees. Now, if we were able to cut emissions dramatically, the bottom line there, the bluish purple line, you can see that hopefully we should be able to maintain temperature increases to 2 degrees or less, which is the cutoff point that many climatologists feel is essential to keep below in order to reduce the risks of catastrophic climate change. So where are we after Paris? Well, Paris, of course, was in many ways a diplomatic and political success, but it left a lot of unanswered questions. If we implement the agreement in Paris, then it looks as though we may go towards about 3 degrees warming by the end of the century. But we also need to ensure, in addition to implementing that agreement, we also need to get renewed political momentum towards deeper emissions, deeper cuts in emissions, in order to get back to that 2 degrees target. So at the moment, we're looking to a planet which could be 3 degrees warmer, with a growing population, perhaps 10 billion people by the end of the century, perhaps 4 billion in Africa by the end of the century. And you can see the urban trends in this slide, which shows you the pronounced differences in different parts of the world. So in Africa, of course, we are seeing a rapid urbanization, which is the top of the slide on the left. The rural population still predominates, but around 2030 or so, there will be a crossover and the urban population will become greater. In Asia, similar sort of pattern, but probably the crossover will happen a little bit earlier. And of course, in Europe, Latin America, we have a predominantly urban population, a great majority of the population in urban settings, as indeed we have in North America. So there are big regional differences, but it also gives us a clue as to the different challenges for urban futures. So many of the cities in Africa, for example, that will predominate in the latter part of the century are still very small. Much of the growth will occur in smaller cities. Some of them haven't even been built yet, which means that there's still the opportunity to develop some of those cities in different ways than we developed our cities. But for Europe, many other parts of the world, the challenge is, in a sense, to retrofit our cities in order to cope with the challenges coming over the horizon at us very rapidly. This slide you've already seen, so I won't repeat it, but it does show the dramatic difference in greenhouse gas emissions per capita between a city like Atlanta, a sprawling city, and a much more compact city like Barcelona. And those differences also have implications for human health. But it's important to remind ourselves that really about 3/4 of the global energy-related greenhouse gas emissions are generated through activities which were undertaken in cities. And of course, the great majority of the global economic activity is also generated in cities. So The future of planetary health and of climate change mitigation will depend very much on cities. But it also has other implications, the urban form, if you like. And again, this shows another image of Atlanta, and it shows us the urban heat island. So the urban heat island, of course, as many of you are aware, is the observation that the temperature tends to be higher in the cities than the surrounding countryside and the suburban areas. And that's because, of course, there's different albedo in cities, because urban surfaces tend to emit thermal radiation at night, and therefore cities don't cool down as much as the surrounding areas. And some work by colleagues of ours in the States have shown that the rate of increase in the annual number of extreme heat events over recent decades has been much greater in the most sprawling metropolitan regions in the US than the more compact metropolitan regions. So that suggests to us that the challenge of thermal stress and some of the challenges of climate change, not all of them, will be magnified according to the way in which we develop and exploit our cities. In Europe, we have the experience of the 2003 heat wave, which was responsible for around 70,000 excess deaths in Europe. In France, about 15,000. And what was very striking there was that there was a period of about 2 weeks in August 2003 of sustained and unparalleled levels of heat and thermal stress, which are shown on the map here. The bottom part of this slide, you can see the black line, which is the trends in temperature, and the red line is the projected future changes in temperature. So what you can see is that the European summer temperature, which seemed so extreme in 2003, is likely to become the norm in the 2030s. And we know that the risk of death, obviously higher amongst the elderly, but also higher amongst people living in the upper floors, often of unair-conditioned buildings, was a higher death rate also in those people living in residential homes and other facilities. So it was a very important wake-up call, not just for the French public health authorities, but also for our own. And in fact, France has now put in place early warning systems to cope with heat waves, which do, at least for the moment, seem to be having the desired effect. There's also going to be major implications for our capacity to work, particularly in tropical and subtropical regions. So this slide shows you the inability to work due to thermal stress with present day, which is the top part, where you see it's largely green and yellow, and that signifies that people can work for 60 to 70% of the hottest months in those regions. But if you look at the bottom, you see the colours changed. It's now become red and orange and yellow predominantly, and that means that perhaps for only 20, 30% of the time will people be able to work at these at least outdoor, unair-conditioned kinds of work, heavy labour and so on. And that will, of course, drive many more millions of people into poverty. And it's going to be very difficult to adapt to those kind of temperatures for these kind of workers, because many of them work in situations which cannot be adequately air-conditioned. So that's going to have very major impacts on health and well-being in the future. It's not just temperature, of course, also precipitation changes. They are more uncertain than changes in temperature, but this slide shows you a kind of mean of 32 different climate models as to where there'll be changes in soil moisture. And the reddish shows you where there'll be drying, for example, around the Mediterranean, parts of Australia, southern Africa, southern parts of the US, and where there might be increases in precipitation. So in East Africa, Russia, parts of South Asia. So there's likely to be an increase both in exposure to drought, which could magnify current stresses on fresh water. And we know that many societies around the world are exploiting their limited fossil water supplies, which can't be replenished on human time scales. And on top of that, then we'll have the additional stress of climate change. And other parts of the world will be exposed to increased flooding as well. But flooding doesn't just come from increased precipitation, it also comes from sea level rise. And this slide shows you how many millions more people are projected to be flooded every year due to sea level rise by the 2080s. That's a fairly conservative estimate. It doesn't take into account the potential for greater levels of sea level rise, for example, if the Western Antarctic ice sheet becomes unstable and starts to melt, then that could obviously accelerate these kind of issues. And the big red dots are where more than 1 million people are likely to be threatened by sea level rise by the 2080s. And that will bring with it a whole range of health problems associated with flooding, obviously the immediate deaths and injuries, also increases in infectious diseases, particularly low-income countries, diseases like diarrheal disease, respiratory tract infections, mosquito-borne diseases, and so on. Major health effects due to economic losses, but also we're beginning to understand that there are long-term mental health consequences from being flooded. So if you follow people up, a year after they've been flooded, you find very high rates of depression and anxiety, which interfere with people's ability to recover from flooding. So the challenge then is to develop sustainable and healthy cities to address some of these burgeoning environmental threats, to reduce dramatically the environmental footprint of cities. So, for example, with greenhouse gas emissions, perhaps 10% or even less of what they are now within a few decades, but also to create cities that are resilient to the environmental changes that are already in progress and which we cannot stop. So these three interlinked challenges: reducing environmental footprint, increasing resilience, and promoting and protecting health. And I just spend, in concluding, just spend a few minutes on giving you some brief headlines of policies that I believe can do both. Obviously, policies around transport have a tremendous potential both to reduce greenhouse gas emissions through low-emission vehicles, for example, through autonomous vehicles, which will be safer, lower greenhouse gas emissions, increase public transport, but also increased active travel, in other words, walking and cycling. In addition to air pollution, which is a major killer, ambient air pollution kills well over 3 million people a year around the world. Sedentary lifestyles are also a major killer. So over 3 million people die around the world as a result of sedentarism, which is a risk factor for many conditions: heart disease, stroke, some types of cancer, diabetes, and so on. And we've done quite a lot of work looking at active travel and clean transport policies in a range of cities, in, for example, London and Delhi. And we've showed that there would be major net benefits. There may be increases in risk of injury, which can be partly addressed through better policies, but these will be greatly outweighed by the benefits to health from getting people walking and cycling, and also reducing exposure to air pollution. And the bottom part of the slide just shows the potential costs averted to our National Health Service here in the UK by strategies to promote active travel and to promote low-carbon transport policies. And this could result in savings of perhaps 17 billion or so over a 20-year period, increasing over time from reduced conditions like stroke, heart disease, diabetes, etc. Some recent work done by colleagues at the London School, Ellen Flint and Steve Cummings, has also looked at the relationship between commuting, urban commuting, and obesity. Obesity, of course, is another big global epidemic which is occurring all around the world, partly due to dietary change, but also most likely due to changes in physical activity as well. And what they've shown is using a UK Biobank, which is a voluntary study of over 500,000, some of you may be in that study, 500,000 volunteers around the UK. And they've showed that there's a strong relationship between commuting and percentage body fat in midlife. So, for example, on the left is the car only, that's the reference population. And then you can see, as we go towards the right of this illustration, you can see increasing levels of physical activity in commuting. So at the far right, it's people who cycle or combine cycle and walk to work, and they have a substantially reduced percentage body fat compared with people who use car or mixed car and public transport. And so there seems to be a dose-response effect in this relationship, as you can see. We can also do a lot through housing. This slide just summarizes some work we've been doing on household energy efficiency, my colleagues Paul Wilkinson and others in the UK. And it shows you the difference between a building which has been a house which has been insulated with new windows on the right, and then on the left a thermal image of an uninsulated house. And you can see there's a dramatic difference in heat loss. And this work involved modeling the health implications of this. And what they found that there would be possibly around 5,000 deaths a year reduced as a result of improved household energy efficiency in a country like the UK, and major reductions in greenhouse gases. But interestingly, one of the conclusions was that you can't just seal houses up, you also have to ventilate them properly because otherwise you get a build-up of indoor air pollution, particularly those tightly sealed buildings. But you can also, in low-income settings, have major benefits to health from housing policies. And this just illustrates some of those. One of the benefits is from clean energy, clean cooking particularly, which kills around, indoor air pollution, household air pollution kills about 4 million people a year, particularly women and children, because of the extraordinarily high levels of high particulate air pollution. So low emission cook stoves, electrification can have big impacts on human health. Kerosene lamps, we're now understanding, are quite a major health threat. They emit lots of black carbon, which is a powerful climate pollutant, but is also very damaging to human health. And so solar lamps can provide a clean source of energy, which actually in the long term is cheaper than kerosene, also much healthier than kerosene. Water and sanitation can enhance resilience, of course, to extreme events and also prevent diarrheal diseases. There's a lot we can do to make housing more resilient, such as this illustration of some indigenous housing here, which is raised above sea level. And we can prevent the ingress of insect vectors of disease, such as malaria, by better housing design, mesh or window screens, and so on. So by combining these different strategies at very low cost, we can create much healthier, low-emission housing, which is also more resilient to environmental change. We can't neglect diet as well. Diet is a really important driver of environmental change. A lot of environmental change is related to food systems, not just greenhouse gas emissions. Probably about 29–30% of greenhouse gas emissions are related to the food and agricultural system in total, but also it drives biodiversity loss and so on. And so we at the London School and many others are doing work on low environmental impact diets, which can also improve human health. And this slide just shows you the difference in dietary footprints in terms of greenhouse gas emissions of different types of diets. So the very heavy meat diet, particularly ruminant meat, which of course is associated with very high greenhouse gas emissions, and then a higher intake of vegetables, which is associated with lower emissions. And we've shown that for the UK, you could reduce emissions by 30 or 40% by moving towards a diet which had more fruit and vegetable, less animal products. Not necessarily going to a vegetarian diet, but more moderate consumption of animal products and higher consumption of fruit and vegetables. And that would have major benefits to human health as well as to the environment. So providing access to affordable, sustainable, healthy diets in urban settings will be a crucial component of urban sustainability. We're also beginning to understand that urban green spaces are important for human health. They can, of course, reduce the urban heat island effect. They can reduce air pollution to some extent, although it depends on what kind of trees you plant in them, because some trees actually produce volatile organic compounds, which can be ozone precursors. But probably more importantly, they can actually also help with mental health. And this slide just summarizes the results of a range of studies. The vertical line is the kind of zero effect, no effect. And you can see on the left, there's benefits to reduced anxiety, anger, fatigue, sadness, and depression from people who have exposure to natural versus synthetic environments. And that seems to be a fairly consistent finding. So providing accessible, affordable, safe, secure green space in cities can also help to reduce the burden of mental health. Restoring ecosystems can play an essential role in regulating fresh water quantity and quality. And we know that many cities are confronted by shortages of fresh water. And about a third of the world's largest cities source their clean water from protected areas. So enhancing and strengthening the protection of watersheds is going to be crucial for sustaining freshwater supplies in the face of climate and other environmental change. For coastal cities, as well as hard solutions to building up coastal resilience, there's also ecosystem restoration. For example, the protection of mangroves and the restoration of mangroves and other natural wetlands can help to reduce city vulnerability to tsunamis, to sea level rise, to other extreme events. And it can also provide a refuge for biodiversity as well. But it's important to think about the potential adverse health effects, because some wetlands can also facilitate the growth of health damaging mosquito populations, for example, transmit malaria and other diseases. So one needs to think through the kind of adaptation strategies and make sure they don't have unintended adverse consequences. So there's a lot that can be done to create more resilient and adaptive cities, but there are limits to these. There are physical limits. Small low-lying islands, for example. There are behavioral limits. People often don't want to migrate away from the areas, the cities that they know and love. And there may be technological limits as well to the extent of flood defences that we can employ, at least economically, to protect some of these very large and growing urban populations. So in conclusion, what I would say is that there are a number of things that cities can do for climate change mitigation and adaptation to promote planetary health, if you like, in the Anthropocene epoch in which we find ourselves. They can promote accessible, efficient public transport and active travel, and design cities to facilitate the free movement of people without undue dependence on the private car. They can promote universal access to clean, low-carbon energy, particularly for low-income groups. They can provide safe and secure access to green spaces and support ecosystem strategies for resilience. And lastly, they can put in place housing improvements which will provide for particularly low-income populations clean sources of energy, water, sanitation, and also provide protection from violence and insecurity, but also from disease vectors. So although the future to some extent is hazardous, there's a great deal that can be done with the political will to put us along a much more sustainable track in which we live at much lower levels of environmental impact than today, but also create resilient cities which can sustain the growing world population in decades to come. Thank you very much.